Sutherland from UVA neurology calling in for an iTREAT call.
Hey, Dr. Sutherland, how are you?
Working with our team here in the Center for Telehealth, decided that we were going to try this idea of doing telemedicine to a back of an ambulance. We sort of see around us every day that we use technology, mobile technology, to communicate in all forms and fashions with our friends, our family, and business settings. And more it's being integrated into healthcare, and that's really the motivation behind mobile health or mHealth. So the iTREAT kit is a system of components that we have built essentially into one portable item that can produce bidirectional video conferencing to the back of an ambulance for the purpose of in our case, a neurologist or a stroke specialist at the hospital to communicate with an emergency medical services provider and a patient that were traveling to the hospital in the back of an ambulance. For diagnosing acute stroke, it requires a neurological examination, and we use a standard validated exam tool called the NIH stroke scale, and that's an exam that's done by emergency medicine physicians and vascular neurologists and neurologists out in practice to diagnose and to measure the severity of an acute stroke. And it can be done over a video conferencing application. It's been validated over a video conferencing application, and that's the core of the practice of telestroke, which is a hospital or a hub where you have neurological expertise connecting to a rural-based hospital or emergency room where a patient may come in with a stroke, but there may not be a neurologist available or a stroke specialist available, and we can see that patient, we can do this examination, and we can help guide the diagnosis and the treatment decision. So iTREAT takes that hub and spoke outreach concept using telemedicine and seeks to apply it to ambulances. And the reason that that's important is because patients in a rural area may be picked up at their home or out in the community setting and then triaged immediately to a hospital where there's neurological expertise and they can receive high-level acute stroke treatment. But they may be in the back of that ambulance for 30 minutes, maybe even up to an hour in some cases in our area. And so that is valuable, golden time that we could begin to evaluate them, to get the history that we need to do our neurological examination, even over a video conferencing application, such that when they reach the hospital, we've taken some of the time consuming activities that normally happen after the patient gets to the hospital. We've done them before they get there, and we can move more immediately to appropriate treatment. And so it saves time and ultimately translates, hopefully, into decreased disability for them for the rest of their lives, and that's the goal. iTREAT study, which is improving treatment with rapid evaluation of acute stroke via mobile telemedicine, it's a mouthful, so iTREAT, is a research study, and we are right now testing the feasibility of this method. This has not been done before using this kind of equipment in rural-based setting, and so we are still in the phases of determining how easy it is to implement, how reliable it is to be able to get that neurological examination. And that's part of the research that we've done so far with the goal of ultimately realizing that degree of feasibility and then disseminating it in a broader clinical trial or for other systems to use. The really neat thing about the iTREAT study is it's just a very small example of how we can use our imagination, our creativity, and the resources that we have at our disposal to improve patient care in an innovative way.